I just want to welcome you to another of our Library on Demand webinar series from the Robert B. Greenblatt MD Library here at Augusta University. I'm your presenter, Peter Shipman. I'm the embedded librarian for the Dental College of Georgia and the Georgia Cancer Center. So Library on Demand is a series of tutorials for the Augusta University community to learn more about what we have for you here at the Greenblatt Library. The archive of earlier Library on Demand tutorials are available on the Greenblatt Library website through that research guide URL that you see on the screen. So today we're going to look at two specific databases. We're going to look at the Cochrane Library and also the TRIP Database Pro version. So if you're watching today's seminar or webinar, I should say, live, we really want you to go ahead and use that chat feature. I'll try to notice if you are trying to chat me a question. I'm not always that aware of the commands on WebEx, but I'll do my best to respond back to any questions you might have. If you're watching the archive version of today's presentation, just send me a question to my email address, pshipman, P-S-H-I-P-M-A-N, at augusta.edu. And a visual note, sometimes things will get a little distorted based on just the way the layout appears in the browser, so just be patient. Hopefully I'm going to try to boost some of the resolution so that you can see some of the more important aspects of each of those databases. So today what we want to try to do is basically learn how to find more evidence, and we're going to compose some search strategies for each database. Now, just think about what we're going to be looking for. We're going to be looking for high quality evidence. We're going to try to get to that as quickly as possible. When I say high quality evidence, I'm speaking mostly about filtered or pre-digested evidence that's been appraised by others. And this filtered evidence is usually found in the form of systematic reviews or guidelines, randomized controlled trials, but other unfiltered evidence can also show up in some of the databases, especially TRIP. So Cochrane, more of reviews, systematic reviews along with clinical trials, and then TRIP tries to look at a little broader segment of things, but it's going to be a very different experience than what you would have if you were to search inside PubMed. So we're going to start right now with the better known Cochrane Library, and then we'll finish up with the TRIP. So Cochrane likes to use this phrase a lot. It's just simply we are providing credible information to support informed decision making. So the Cochrane Library, if we were to think of the library as a whole, is a group of 6 databases along with a few add-on resources that are produced voluntarily by the nonprofit group, which is now known as simply Cochrane. So this was formerly known as the Cochrane Collaboration and was named to honor Archie Cochrane, an epidemiologist who advocated back in the day for the creation of systematic reviews of randomized controlled trials. Basically what we call evidence-based medicine today. The whole idea was to decrease the gap of knowledge with practitioners so that they would more quickly bring new evidence into treatment care as soon as possible. Now Cochrane does have volunteer groups called Cochrane Review Groups based on discipline that create 2 major databases. So when we think of the library, there's 2 databases, so to speak, 2 parts of that Cochrane Library that are used extensively. The Cochrane Database of Systematic Reviews, that's about 9,000 records. We also condense that to an acronym CDSR. Sometimes they're simply called Review inside Cochrane or Cochrane Review. It's the full text of the review. You will also find inside that CDSR protocols. And protocols are not reviews, they're just reviews that are in progress. They haven't been completely finished yet, and you can get full text of both reviews and protocols in the CDSR. And these come out monthly, almost like a journal, and they are indexed extensively in PubMed. So they're very sought after. Um, if you go to the PubMed homepage, you'll often see some CDSR content that's listed under latest, simply because they want to disseminate those as quickly as possible. The other part of the Cochrane Library is the Cochrane Register of Controlled Trials. There's about 900,000 records of these trials. And it's also shortened to the word central, and when we actually look at the search interface, we'll see it shortened to the word trials. Now, what these do is, in the process of creating these systematic reviews, these Cochrane reviews, many of the review groups will identify trials, and they'll link it to an article that appears in one of the two major databases, either PubMed as well as Embase, which is the European version of PubMed. And these also come out as a monthly journal issue, but there is no full text, but it will link you to the appropriate PubMed or Embase record. Now, I do want to mention that we will come across 4 other Cochrane databases. These are no longer actively curated. They sort of sit there. Cochrane hasn't decided whether they want to continue with these or not, but you will see their content available on the site. But this tutorial today will not cover those databases. So we will see them. One of the more popular ones is called DARE, D-A-R-E. We'll see some of that content get pulled up when we look into TRIP. So it does exist, it's sort of there, but Cochrane at this point is saying we're sort of supporting it because the content's there, but it's not being actively added to. So when we get into Cochrane, what we're going to see is we're going to see a new and an old interface, and the great part is we don't have to search for different variants of words. This is a UK-based product, so we don't have to think of a lot of common British and American spellings. They'll cover that for you. We do ask, though, that if you are searching for a drug substance, that you use the generic name, and whenever you do search, it's usually easiest inside the Cochrane Library when you're looking for reviews or clinical trials to simply look by the disease condition or the topic. Now, we can browse as well because there aren't that many Cochrane reviews. It's still very browsable by both topic and review group. So what I'm going to do is I'm going to pivot from here. We're going to start at the home page for the Greenblatt Library. We always want you to start here whenever you use one of our databases. Everything that you see here is available off campus with the exception of UpToDate, but the Cochrane Library as well as TRIP database both are available off campus, and we actively urge you to go ahead and use it. Now, a word about our webpage. Our webpage is in a sense going to be redesigned. So what you see here as we move into the future, I'm recording this at the end of March 2017. At some point we will have a different look. However, we're always going to make sure that you have links to our databases, so there's a couple ways to get into the product. The most common way under quick links, which is the default setting for most people when they come to our homepage, is to simply go down to the link that says View All Databases. You'll see an A to Z link, and that A to Z link will let you go down to Cochrane Library, and you can go ahead and click. You'll see that the central register is also listed, as well as the database of systematic reviews. However, I like to go right to the home page. It seems to be the best way. The other way that we can do from that home page is you go under Resources. There's a link there as well for Cochrane Library. So those two are the most common. And I would tell you that if you even are inside Wiley Online Library, which is also in our View All Databases, Wiley distributes the Cochrane Library. So if you're in this Wiley Online Library, you can simply make a search for the publication title Cochrane, and it will pull up the Cochrane Library, and you can actually link into our content, into that Cochrane Library content from the Wiley Online Library. So there's 3 different ways to get in there and get at it. And remember, if you're off campus, you will have to use your Jaguar ID to be authorized to use the material. So we're going to go ahead and click on Cochrane Library. And what you're going to see here is the new interface, and that's why I kind of like it. It's got a little more color, it's a little bit bigger, it's a little more visual. So as we look at this, you're going to see a basic keyword box. So if you actually want to search for something, you can go ahead and click there and simply search by title, abstract, keyword. That's usually good enough to try to get to much of our content. In that sense, it works pretty well. And the other idea that they have is browsing. So if you stay with the browsing idea where you just want to browse through material, you can browse through these Cochrane reviews very easily and stay inside that new interface. You can browse by topic or review group. So for example here, if we were to go by topic and simply go under kidney disease and use one of the narrowing features on the left hand side, we can reduce down to maybe end stage. We will see that there are 37 reviews or protocols, right? There are 30 reviews, 7 protocols. Protocols are those in process. And you can see here that they're listed with the newest first, and they color code everything so that you know that it's a review. They like to use the word intervention for Cochrane reviews. Those are usually treatment. So usually when we see intervention, that's going to be most of Cochrane reviews will be on treatment or intervention. You'll also see tags listing diagnosis as well. And what's the nice thing about using this interface, because when you think about it, this content is also indexed in PubMed. Well, what makes this interface better than looking for Cochrane content in the PubMed interface? I will tell you that when you're in here, you can see that whenever a change is made, these records are not static. They don't really stay the same. They're constantly looked at by the review groups. So here's one on antidepressants for treating depression in adults with end-stage kidney disease treated with dialysis by Palmer et al., published May 2016. They've actually said here we've changed some of our conclusions since this was initially sent in May 2016. So you can kind of see where anytime a change is made to a review, they're going to let you know about it. Sometimes there are new searches, and they've actually added more content to it. So I'm just going to click on the first one, and what you're going to see here is literally the entire review. You can read it right there in the web page, top to bottom. You can hit this little go-to tab in the upper right to navigate through the different sections that appear. And one of the things that I like to do 2 things lots of times when I'm inside reviews, and these are just my preferences. I like to go to the upper left corner. There's a PDF link. When I click that PDF link, it'll give me 3 versions that I can choose to read about this particular review. So it depends on how much I care to read about. I can read a summary, I can read a standard review, or I can go into the full review and see even more. And that can be very advantageous. I also like to click the little eye, the little information icon that's next to that PDF icon up in the upper left corner. And when I do that, what I will see here is some useful things such as the medical subject heading. So if I want to do a wider search, look inside PubMed, many times these medical subject headings, this would help me do a better search. So I do like those. So that's kind of how you go in by topic. And if we were to go under Cochrane here again, back to the home page, go under reviews, we can look at review group as well. So here, if I just pick out one of the review groups, here's neuromuscular. This one has 160 records, and you can just sort of go by topic. There's 2 that are related to cancer. Looks like a particular substance used for myasthenia gravis from 2012. So this is a very easy way. I usually like to use a lot of the review groups to simply go into the topics, because they're usually pretty manageable and very browsable. The exception would be if you get into something larger, such as the cancer, head and neck type things. They can get pretty large, so you may choose to search those instead. Here for lung cancer there were 43. That's pretty browsable. Okay, you can kind of take a look in. So what happens when we do a search? See, we did Cochrane reviews and we simply went ahead and browsed by those two topics we stayed in the new interface. When we go ahead and search CDSR, what happens is we pivot from that new interface to the what they call the old interface. So if we were to use that search box on that home page, we would come to this type of look. There's 4 different tabs that appear on the search interface. The search one is usually pretty good. The medical subject heading is another good way to find content, and the browse simply brings you back to the home page that we saw with those groups and the topics there. The search manager is a very sophisticated tool that works with the medical subject heading tool. We're not going to go through search manager. It has a lot of command searching in it. That command searching can get pretty intense. This is for extremely advanced searchers that are trying to drill quite a bit down into the Cochrane Library. But here I would say if we looked at the title abstract keywords, we would usually do pretty well. And so you have some choices here. So if I were to go ahead and just put in end stage kidney disease and run that search, we see here that there were 2,000 records that were pulled completely out of the library. Now on the left hand side, I can go ahead and literally look at the different parts of the Cochrane Library and simply go ahead and limit the results. By default, it shows me just the reviews. So there were 72 reviews that are either reviews or protocols. There are other reviews. These are systematic reviews that are produced by other groups that Cochrane has also looked at and approved. So these are ones that are not Cochrane systematic reviews, but other systematic reviews usually produced by the York University group, the Center for what's that center called? I guess it's here it is, the Center for Reviews and Dissemination. That one is there as well. If we click the little radio button down to trials, we'll move into the controlled trials and we'll see obviously much larger results. We'll also see radio buttons for those I don't want to say discontinued, but the databases from Cochrane that are on hiatus. So there's methods, the technology, the economic evaluations. Those, if we click on those, we'll see those as well. And like we saw with the reviews, you will also see a color-coded group that will sort of tell you exactly what you're looking at. This can help you quickly decide whether or not you want to drill down into the content or not. So this is all pretty easy to do and use. So the search obviously does a very good job. If you're not happy with the default search of title, abstract, or keyword, you can list and limit by author. You can search inside abstracts. You can search just by the title. If those are happy, the way you want to work, those are certainly good things to do. If we were to go into the medical subject heading, so if we were to put in, I'll just put in the term. Let's see, what should we do? Let's just go ahead and put in otitis media. Let's see, otitis. And it's going to help me spell that. So here's one with effusion. And if we look up the medical subject heading, it's going to map to the medical subject heading for us. And there is an exact term match for us, and it'll allow us to look at the tree if we want to go more general or more specific. Superlative is another one that's equal with that. And we can also see here all the results that are linked to this mesh descriptor search. Now the only negative when you do use the medical subject term, now obviously we're US based, we like the mesh, anytime you look at the trials, these 382 trials that are listed here will only be linked back to PubMed records. Will not be able to, if we use MeSH, look at any of the Embase records, the European version of PubMed. If we use MeSH, those sort of get excluded. So you can see where this does allow you, if you're very comfortable with searching MeSH, we'll find things. If we click results, we'll pivot back into that same traditional look that we saw before. You can go ahead and move among the different groups of Cochrane content, and then over here on the right, I'll go ahead and take a look and click on things. Here's antibiotics, and again, there's the PDF, there's the information. This was created by the ENT group within Cochrane, and I think you can see that this is a pretty easy way. You sort of have the choice of starting here and running your search, going back and running your search. It works either way. So for Cochrane reviews, extremely good. Now it comes to Central, when we're looking for those controlled clinical trials, it can get a little bit more difficult. So what I mean by that is you're pretty much always going to be in this search interface. And under here, under search limits, it automatically picked trials, and you can at any time change these and apply them to the search interface that you're in when you're in just the basic search mode. That works very well. So if we looked at wow, my browser's a little bit. Let's take a general look for that. You do go. So here's 2090 trials, and you can go ahead and take a look at those and take a peek in. I'll just click on the second one. Now we're not. Oh wow, they did add an Embase number when it does agree with PubMed, so I was wrong. I thought when we used MeSH it was going to exclude the Embase. I was wrong. You will get some Embase records in there. So, not bad. Okay. That's good to know. Alright. So, there you go with the trials. Now, what else is in Cochrane that would interest you? Well, let me go back to my PowerPoint and make sure we're right up there. We did talk about those search interfaces already, about how to go ahead and do those. The other thing that I would want to point out that's sort of interesting is under more resources. So there we see the ones that are no longer being actively added to. So we see DARE, we see the methods studies, the technology assessments, the economic evaluations. Those four are pretty much out. However, they have added a few things. The Cochrane podcasts are interesting. I know a lot of physicians are interested in podcasting and listening to those. Those are great to have. The other thing to remember here is there's a new one called Clinical Answers. And Clinical Answers is a little bit different. When you click on it and look at it, you can sort of drill down and take a look at Clinical Answers. And what it really does here, I think it's more of an educational tool. When there is additional information inside a review, it will link out to Clinical Answers if there's a clinical answer that has been created as a result of a Cochrane systematic review. For example, here I'll just click on this first one, benefits and harms of fluoride mouth rinses, okay, for preventing dental caries. So here, when you go down and take a look, when you look at additional information, what it will usually show you is where they got this clinical Cochrane thing. This came from, this was derived from fluoride mouth rinses for preventing dental caries in children and adolescents. And this is gives you the review number, the issue, and it's review number 2284. So it does link you out to it. And the reason that I like this is it helps you, in a sense, create Pico, and can help you learn how to maybe improve some of your clinical question skills in a way that I think would help you maybe articulate a problem better. So that part's kind of interesting. Normally we would create a clinical question, create a Pico, and then go ahead and dive in and run a search. Here it's sort of the reverse. They're sort of linking a question to a Cochrane review, so that makes it interesting. And on the right hand side you'll see too that here are related clinical answers. So there's some others that can also pique your interest. And here's some outcome data to go with it. So it's just that clinical answers is more of an interesting educational product that I think you might want to take a look at. The other nice thing when you're inside Cochrane Library and you're doing a search, let me make sure I'm in the right spot. When we're in the Cochrane Library, the other thing to remember is it is supported inside things besides just your desktop computer. So if you have an iPad, if you have a tablet, if you have a smartphone, they might be harder to maneuver around in, but it is adaptable to those devices. So we do recommend that if you do use those products, Cochrane is supposed to be very adaptable to them. It doesn't really work for the library on demand where we're trying to show you and record this, but the iPad and that is certainly very good. So just to review, when we get into Cochrane Library, we're trying to get that high-level evidence stuff at the very top of the evidence pyramid. We're looking for systematic reviews. We're looking for controlled clinical trials. It's very easy to browse into the Cochrane reviews by topic or review group. However, when we do hit the search button and go ahead and run a search, so if I put in stroke and telemedicine, and we do run a search, we can basically go ahead and just go ahead and take a look at those right away. It works very well. It's pretty easy to use. I think you'll be able to find some things. And just remember the size of things of the databases. With Cochrane reviews, only about 9,000, right? With the trials, you're looking at 900,000 clinical trials. So obviously your result list will be a little bit different, and your expectations of what you would find would be different as well. So those are what we have, and we certainly want you to take advantage of that Cochrane Library. We think you can do a search that would actually look at this particular content. It's a little bit easier to kind of see the changes that are made, and as opposed to going in and searching through PubMed. So we do definitely want you to go ahead and do that. So what's our next database? Let's go back to our databases link, and we're actually going to go into a new one that we've had that's called TRIP. So let's go ahead and take a look at what TRIP is. So TRIP database is turning research into practice, right? And their catchphrase is find evidence fast. So the whole idea here is, again, a simple search interface. This is UK based as well, United Kingdom, so very British. It's going to look at a lot of non-US sources. It has a few features such as a Pico search interface, as well as image and video result lists when available that are very interesting, and also a smart search. Now, right now we're getting TRIP database as Pro. You may have used TRIP database when it was free. I know I did. It was extremely useful as free, but now we have the Pro version. And with the Pro version, you get more content. They've added more content, full text content for you to look at. And then they also allow you to create a search history, and they also allow you to star specific records, and you can retain that list. The search history is useful if you do several lines of a particular search and then you want to combine with AND or much as you would do inside a PubMed Advanced or inside Ovid or inside a Sinol. So having that Pro version has allowed us to not only get more content, but also to find that content a little bit better. There's also a smart search feature, which is more like a related articles link that you would often see inside PubMed. And what it does is, even though you haven't searched for it, if it sees that you're interested in, or you're linking to a single record, you're looking at really hard at that single record, it may also suggest some other related records that it thinks you might be interested in using a search algorithm. So let's go ahead, we'll go ahead and look in that. So what we're going to do again, we're going to start the Greenblatt Library homepage. We are going to go under Quick Links and then go to View All Databases to get that A to Z look. We're going to go down to T, where TRIP Database is, and we're going to click on it. So here's your TIP Pro. You have 4 different search tabs. And if you do log in, you are able to use a few more of the features. So maybe I should go ahead and do that. So I'm P. Shipman. Don't know how that worked out, but there we go. So there's your search box. So if we were to go ahead and just do a search, so I'll just run a search on 2 ideas, pollen allergy with immunotherapy. What you see here then is, in the left hand side, a full result list with the evidence. We have 1,100 records. On the right hand side, we can both refine it by type of evidence as well as clinical area. So if I was very interested in just systematic reviews, looking at those, I would go here under evidence type, click on systematic reviews. I'd go from that 1,100 look down to the 44 that are systematic reviews. And you can see here that it'll give you a few more links. You can star it, as I mentioned, because I'm logged in. It'll allow me to star. It also visually gives you a look of an evidence pyramid. So it's kind of hinting to you that these systematic reviews are extremely highly rated. They're at the very top of the evidence pyramid. On the right hand side, you're going to see the Cochrane that we saw before. You're going to see 2 other Cochrane databases. Here's the Economic Evaluation Database, the DARE, as well. So there are some records that, even though they're not being currently updated or worked around, you can do that. You can also link down to just the CDSR, the Cochrane Review content, and there you have it. So that one's pretty easy. Now if I were to go back and let's just rerun that search back to the 1108, I don't know if I'll find images or videos. They're just there if they happen to be there. But here's one where there appear to be some images that you can use that they associate with pollen allergy or immunotherapy. There were no videos available on that one. So that one, not. But I think you can see where you can get into there very quickly. The other thing that's interesting, you will see guidelines, and you'll see ones that are non-US based. So that's not bad. The key primary research, these are very interesting because, in a way, this would be material that I think is kind of interesting. They do have some evidence related stuff, but here it's just linking back to a PubMed content. So I think it's not bad. It's not trying to find everything. It's just trying to find some things. The primary research can be interesting. Again, you're going to find a lot of journal literature under the primary one, but it certainly is one to look at. But you're also going to look at clinical trials and some e-textbooks, blogs as well. So those are all sort of interesting ways to sort of find things. One of the things I mentioned earlier was how interesting the Pico search was. So if I just go from basic search to Pico, I can in a sense run a full-blown Pico search, which is very easy. So if I just type in my ideas, so let's just say I want to look at cancer diagnosis, and let's just say I want to see how well, I know there's been some articles lately on dogs or canine and we'll just take a look and see what those have. So there's 895. Ooh, now this one didn't come out too well. Look at that. I might have to redo this one because it's looking at the word dog. I pulled up dogma. It will fill up other words. So here's one. Here's the cancer odor detection dogs. So it will pick up some of the things we do want to see. It may pick up some other things we don't. And we can see here primary research, blogs. It's ranking that evidence for us. So in some cases, I think I confused it a little bit with that PICO. That wasn't a good PICO to try. Let's look at one with, let's say, gout and colchicine. Let's see. I think I spelled that correctly. That's just a drug image. So here you can look at particular drug databases. This one we didn't really find that much. A little bit light. Okay, so you do have to play around with it a little bit. We did stroke before, telemedicine. Let's see how that one works. Found 40. Don't know that I'll find images. Nope, sure didn't. So again, the images and videos a little hit or miss. Obviously some of the terms I used didn't work that well. That's too bad. But it's all there. And if we look at our history, I'm going to go up to the top and look at the history. You can sort of see where we can sort of look at all the history. So of our ideas and just simply save them. So that's not bad. When you look at advanced, I'll be honest with you, the advanced to me, where you're using any of the words, an exact phrase, you're excluding words, this is not traditionally how we teach people to search. Try it. I would tell you not that much in love with it, not that great. I really like the recent one because the recent one does allow you to look at a search history and then combine those search results with your and or. So in some ways I do like the recent. You do have to make sure that you create the account to be able to use that feature. So I would tell you, if you stick to regular search, the PICO didn't really work that well. Let me try one I looked for recently, cancer pain. The intervention was yoga, and the outcome was quality of life. I normally just like to do a P and an I search. I did try an extra term just to see what would happen. There's actually guidelines on this in the USA. How interesting. For cancer pain. Alright. There's a synopsis. 7 systematic reviews. So you can see the whole idea here is you're not really using very sophisticated searches. You can pretty much, without command searching, you're pretty much just going in and running the search, and it works pretty well. So I would recommend that you take a look at both of these. The TRIP database is relatively new. The Cochrane, of course, is very, very well known. But we definitely want you to take a look at each of those when you're looking for that higher rated evidence. I want to thank you for your time today. Check out our archive of other Library on Demand tutorials, other webcasts we've had. If you have any question about today's look, I'd like today's webcast, I should say, just go ahead and send me any questions or comments you have to pshipman@augusta.edu. So thank you for your time again. Thanks.